Our next question is from a listener named Mary Ann, and she asks, in your book, you mentioned that bones do not pop out of place like many chiropractors suggest. Can you explain this a little further?
Yeah. So this is a great question. It'll be a little bit of a longer answer
Mm-hmm.
because there is a framework that needs to be added to it. But where I want to start with this is back to the beginning of when I turns to we, illness turns to wellness. In forming your team, you have to choose who do you want on your team. And so I will say this as I've worked with really great chiropractors.
Mm-hmm.
I've worked with really bad chiropractors. I've worked with really great sports medicine physicians. I've worked with really bad sports medicine physicians. And what do I mean by good and bad? It's their intention. Their
Mm.
intention to truly care for you versus I'm just doing this so that I get a paycheck
Right.
type of thing. So with that being said, this idea of your do, can bones pop out of place? Yes, right? We have dislocations and subluxations. But what happens when a joint dislocates? It hurts like crazy. So if your spine dislocates or subluxes, and your spine is meant to be the protector of one, it creates the form that gives the space for all your vital organs, and then the rib cage comes off of that to protect the things that we need to stay alive. The way that we were designed is incredible to be strong and
Mm-hmm.
robust. So if the strongest structure in our body can just move in and out, well, that's a pretty poor design.
Mm.
The other part of this is what is going through the vertebrae of the spinal column, the spinal cord. So if a vertebrae is out of place or out of alignment, there should be a lot of nerve changes that happen. Either the leg's not working, the arm's not working anymore, the reflexes have changed. That is a medical emergency. It takes a lot of force for a vertebrae to go out of place. I'm talking a car accident, a fall from greater than 10 feet where you're landing on your tailbone. Like there, it takes a lot of force for a vertebrae to go in and out of place. So to the question, can bones, and speaking of the vertebrae, can they go in and out of place? Yes, but the force is a lot of force to
Mm-hmm.
do that. So then what about the narrative of, well, your back is sore, or there's so many other narratives that we can provide. I
Yeah.
won't go down that rabbit
We could
hole.
talk about it for
We
like
talk
65 minutes,
yeah. So
4 hours.
yeah, you're misaligned. So we do this thing and we're realigning your vertebrae, and that's going to help your health or this condition, whatever it may be. Well, all the research now disproves that happening. And there's a lot of different angles that we can come at this from. One is that the force in a manipulation or an adjustment is not enough force to create a change at the vertebral level because of how strong and robust it is. The other part of this is, well, I hear the pop happening. So what is that pop? Because when I hear the pop, it must mean that my joint is changing. All that's happening when that pop is that joints have pressures. They have an atmospheric pressure. When this force is added to it, the joint atmospheric pressure changes, which then forms a bubble.
Mm.
The bubble forming is what creates the popping noise, not the bubble collapsing. The bubble forming creates that. It's this theory of tribonucleation, which has been shown on MRIs. Now, when that bubble forms and then it collapses, nothing changes in the joint.
Mm-hmm.
Nothing mechanically, no properties of the joint changes. It's just a bubble that comes and then goes, to the point that this physician, Dr. Donald Unger, he cracked the knuckles on his right hand for like 50 or 60 years, something around that. And then he tried not to crack the knuckles on the other hand. They did imaging pre and post with this idea of cracking your joints creates arthritis. And there was no changes between the joints whatsoever.
Wow.
So the popping that we hear, it's just a bubble forming, right? So you can do that by leaning over your chair. You can do that in all these different ways. You can create these bubbles forming. Well, don't I need an expert to do the pops, to quote unquote put this thing back in? Well, in order to say that you need an expert to do that, this test needs to be validated. And the validation is typically an x-ray and then palpation. Well, so palpation is going down the spine, pressing on it and going, oh yeah, L5 is a little bit more forward than L4 or L3. So this is where we need to pop this joint in order to get it back into place. So I did the studies with people that were called expert palpators, whether it was a chiropractor, a physical therapy, an osteopath, because this is used in all of those professions. So it's not just chiropractors, it's
Okay.
everyone that's using this subluxation theory. So these expert palpators, they all saw the same patient and they all came at different levels of where the dysfunction was.
Wow.
So there was no reliability between them. So that the test is saying that you need this thing to do this thing, but now the test isn't accurate between providers. So that is showing us that that test really isn't appropriate. It's not giving us the information that we think that it is.
Mm-hmm.
And there's other studies showing that the better that you become at palpating, the least reliable it becomes. So if you're an expert palpator and I'm an expert palpator, the better that we get, in theory, we should come up with the same answer because we become better at palpating. But the reality is, what research is showing is that as you get better, as I get better at palpating, our answers actually become more and more different
Oh no.
from each other.
Mm.
So from the test, we know that it's a little fishy
Yeah.
of what's happening in there. Last part of the research, kind of summing that up, is that if the subluxation theory is true and this joint is out and you put it back in, it should have an effect on that area. But the research is showing that if you have, for example, anterior knee pain and you do a lumbar spine manipulation or adjustment, the pain then decreases or subsides. If you have cervical pain and you do a manipulation of the thoracic spine or an adjustment of the thoracic spine, the mid-back, the cervical spine pain can then be alleviated. And it's not this effect of like a ring dinger happening where all these segments were out and now they're stacking back on top of each other. You're changing the nervous system. You're giving an input that then changes the output, and that's what's happening. So the Canadian Chiropractic Association actually put out a position paper and said, can we stop using, I'm paraphrasing, can we stop using the subluxation theory? The only reason that it should be taught is in historical context of where this stuff came from. But the research of the subluxation theory, which is joints being in and out, the research on that theory disproved its own theory.
Wow.
So do manipulations and adjustments, do they have a time and place? Yes, right? It's a team approach. It's not I, it's we.
Mm-hmm.
But it's making sure that your team is setting you up for success. What does that not look like? Well, it looks like this. Brandy, I need you to come in 3 to 5 times a week because you're misaligned and you need this thing to be aligned, or else you're going to have significant back pain. Because now you're so afraid to move. And kind of a side note, if this pop is putting it back in and you stand up and crack, well, did it just come back out again? Right. If that was like truly happening. Yeah. But now there's this fear narrative that this thing that gives you rise to life, this thing that is housing your spinal cord and creating structure for your vital organs, is a slippery fish that's just plopping in and out of place. How afraid are you going to be to move? Mm-hmm. And I've worked with so many patients that had this narrative that they're afraid to reach down and pet their cat or their dog because they're afraid that their vertebrae is going to go flying out their back. Mm-hmm. And they're not being taught that theory is invalid. Like, we can't fully prove stuff, but we can disprove stuff. And that theory has been disproved. So there's a lot of really great osteopaths, chiropractors, physical therapists that are using adjustments and manipulations, but the narrative around it is different. The narrative is that we're using this as a short-term relief of your symptoms. Now we're going to get into the longer-term changes, whether that's leaning into mental fortitude or leaning into physical training. This is going to create the long-term response versus saying you need this in order to get better.
Right. I'm thankful that you kind of gave the history and the research behind it, because I think we've talked about it, but there's times where I just want to tell my family or my friends or my community, like, your bones are not popping in and out of place. Like, that literally is not impossible, but essentially impossible if you twist your ankle and you like hear a crack and you're like, oh no, now my ankle's out. Like, that's not how it works. It's not that, it's not that common, I guess. It's not as common as people play it out. So the research is helpful, but it's really the simple of, you may need this adjustment, but if you do go to a chiropractor or PT or what have you, go in without the idea of, oh, I'm popping in and out. Go with the idea of there's an adjustment happening or manipulation happening, but that's really just your brain needing a different input, right?
Absolutely. And another example, because I hear this all the time, and I'll be honest, when I was an assistant, I was learning this method of the SI joint being out and popping it back in. And shout out to Dr. Dolphin, who changed my whole perspective on that, because the SI joint moves very, very, very small. It's not detectable by your fingers. It's not detectable by your thumbs being on the PSIS and a person doing a prone press up or leaning forward. You cannot feel what's happening. It's too deep. You need sensors that are put through the skin to the SI joint with imaging to see this thing moving.
Wow.
We are not doing that with palpation and motion testing. Secondly, research from emergency medical rooms have shown that a person can come in after a really bad car accident, fracture their thighs, have fractures in their spine, and the only thing that is still stable is their SI joint.
Wow.
So when does that change potentially? Well, during pregnancy, because space needs to be made for this growing baby inside of you. So at that point, maybe the SI joint has a little bit more motion into it, but it's still not popping in and out of place. The discomfort is because there's something pressing on an area that normally isn't pressing there
right.
anymore, not something being out of place. So it really becomes scary for people when they're getting that narrative. So we can still use manipulations, and I think adjustments are appropriately termed. But the question becomes, what are we adjusting? We are not adjusting your spinal column. We're not adjusting how they're stacked on top of each other. We're not adjusting something being out and putting it back in. We're adjusting your nervous system. We're giving a different input to change the output of that. And I will go on to say this because this gets me really upset from the research that is out there and the side effects that are potential from like a cervical manipulation and seeing these things done. Of seeing videos of this being done on dogs and on babies and on like people that you don't need to have this done to reach what your health and wellness goals are, but they're being told that it is needed. And people are saying, well, we can't disprove this because the science hasn't caught up to what we're doing because it's working off of a different theory. Well, the science that has actually disproved this theory came from the people that are using this theory. So the science is there. If the science wasn't there, it'd be a little bit different. But the science is there now. So now we have to choose as part of our team, are we all on the same page? Because if I'm telling you that you're robust, you're resilient, you're strong, you can deadlift, but then another provider is telling you that your vertebrae is popping in and out, we're not on the same page. Now as a client or as a patient, you're confused on what you should be doing next. You're not sure where to go. You're being told you're strong and resilient, but yet the strongest part of your body is popping in and out. So that's not a team that we're all moving the same direction.
Right.
We're in a rowboat going in a circle instead of paddling the same way. So if you're listening, choose your team wisely. Make sure that people are telling you, like the surgeons that I've worked with, the chiropractors I've worked with, the osteopaths I've worked with, we're all speaking the same language because we've all kept up to date on the evidence and we're using the art and the science. It can't just be an art. It can't just be a science. There has to be an art and a science. And when science is telling us that something is not happening, we have to honor that. Science doesn't tell us what is happening. It tells us what's not happening. So we have to respect that.
Oh, I love that. And I think too, when choosing a team, if two people or two things are incongruent, go to the one that's empowering you to be the best person possible. You know, like I have been the person on the other side who went to a chiropractor twice a week for 6 months, if not more, and would rely on going to the chiropractor regularly for years and years of my life because I believed I was fragile. And it wasn't until really working with Dylan that I realized I am not fragile. I am very strong. And it was a new narrative that empowered me to be the best person possible. And like that's the team I want to be on, and I want to be congruent, and I want to be empowered. I want to be able to empower other people. And so if this is news to you, if this is kind of like a shock, and like we mentioned in the beginning of the episode, we're taking 2 weeks and we're doing every 2 weeks now so that you can digest these things. Digest this and really ask yourself, who's on my team? Who do I want to be on my team? And am I being empowered on my team?
Yeah. And also, like, where is your information coming from? Like if people are saying that this thing is happening, well, can you show me a paper on this, and not a blog that's written on your own website, but can you show me a peer reviewed paper that was in a scientific journal that shows that this is what's happening? Because when the Chiropractic Association puts out a statement saying, stop using this theory. We know that you're using it for paychecks and not for helping people. Like, stop using this. We have to honor that. Yeah. So show me the paper. Like, it doesn't need to be this thing, show me the paper. Yeah. But like, can we have this dialogue where if you're telling me that this is the thing that's happening, well, what data do you have to show that this is? And if it is just your opinion, share that with me, because I trust you as a provider. And if you're saying it's your opinion, well, you've probably formed that for good reasons. So share that with me, but also present that side of the science, which I do with people all the time. Here's the science. Here's my thoughts and opinions. Take both of them. Go make your own decision with that.
Love that.